Allopathic medication, part 6. For example, burning huge areas of forest to make way for the farmland may displace a wild animal species which then infects a domesticated animal. The domesticated animal then enters the human food chain and infects people, and a new health threat emerges. Conventional approach to the environment, animal and humans health rarely examine these connections. In conservation medicine, such relationships are fundamental. Professionals from many disciplines involved necessarily work closely together. Let's talk about One Health and let's talk about the history of conservation medicine. Since the emergence of the idea of conservation medicine, many human physicians and veterinarians have adopted the initiative titled One Health. One Health evolved from the early idea of One Medicine, which was developed by veterinary communities as early as 1900s. Originally, One Health solely promoted the interconnection of animal health and well-being of animals and humans. However, One Health is now a recognized and valued approach to optimize the health of people, animals, and the environment, and has been adopted by a multitude of organizations and governing bodies to guide their work in protecting global health. The United States Centers for Disease Control and Prevention (CDC) and the United States National Institute of Health (NIH) utilize One Health approach to be better understood, to better understand and mitigate threats to human health. The World Organization of Animal Health (WOAH) utilizes One Health approach to improve animal health across the globe, advocate and the spread of veterinary information is in fact their responsibility. The United States Environmental Protection Agency (EPA) highlights their use of One Health to protect the environment, stating, "When we protect one, we protect all." The concept of conservation medicine utilizes a One Health approach and specifically works to decrease disease and health risk humans and animals experience due to the degradation of mutual environment. Now we talk about the social impact on conservation medicines. Social impact on conservation medicines. Looking at the environment and the health together, conservation medicine has the potential to affect rapid changes in public opinion on complex societal issues by making the distant and undefined local and pressing. Distant and ill-defined local and pressing. For instance, global warming may vaguely define long-term impacts, but an immediate effect may be relatively slight rise in air temperature. This is in turn raises this in turn raises the fight ceiling for temporary the temperature. This in turn raises the flight ceiling of temperature sensitive mosquitoes, allowing them to feed on higher flying migratory birds than usual, which in turn may carry a disease from one of the countries to another or in another continent.